I hope all. Good evening, everyone. Good evening, everyone. This is Dr. Sandeep Sharma here, and I hope all of you are doing good. Some of you will be watching this session live, and many of you will be watching this session at a later time. So the purpose of me coming here is sharing about the new Prepladder super specialty pediatric version 4.0 version is coming. What is new? What is going to change? And my purpose here is to share, to give you an insight into what we have done into this new Nelson based new version and how it is going to be pivotal in you getting that top rank and getting that super specialty branch of your choice in pediatrics. Right. So this is version 4.0, and this is the updated version of Prepladder Super Speciality. It has just been released, and this is me connecting with all of you. First of all, I will be taking you through what is new. I will be giving you examples of what is new, and then I will make it open house. And whatever comments are coming, whatever doubts you have, you are most welcome to ask about it. Right? So let us demystify new Nelson. That is what our aim is. That is what this course is all about. First of all, this Prepladder Super Speciality version 4.0, what has changed? First, you need to understand that after almost 4.5 years, new edition of Nelson has come. So what has changed in the new Nelson 22nd edition? Firstly, new chapters have been added in Nelson. Example, a whole section, not a chapter, but a whole section of pediatric immune regulatory disorders has been created. And HLH syndrome has now been added to this particular segment. You have new disorders like trachopathies, interferonopathies, and NF kappa beta factor defect, which all have been added to it. So these are brand new chapters, and they are tough chapters. So what I have done is I have tried to simplify them in the usual way. If you have watched my videos, the way I try to do, not in a cut copy paste manner, but in a simplified manner. There are new topics like chromatin regulatory disorders, and also apart from new chapters, there are treatment updates. For example, if you look at the older Nelson 21st edition, there were just about 10, 15 no, not 10, 15, about 7 or 8 paragraphs given on the treatment of SMA. But now you have more than 1.5 pages given on SMA, and there are new tables. So I have simplified and added that into the new version. Thirdly, new genes have been added in a new diseases because genetic research is ongoing, and subtle changes have occurred in diagnostics as well. For example, in congenital CMV, now Nelson very clearly says that for screening purpose, use saliva. For confirmatory, you use urine, and PCR is now diagnostic test. Earlier, there was ambiguity. So such subtle changes which we tend to miss out have been highlighted in the new Nelson 22nd edition. And trust me, I have tried and still I am going through all the Nelson and comparing it with the older edition. All of you are doing residency. You people don't have time for, comparing the two Nelson. So here I am doing the dirty job for you. What I expect from you is make use of it and enhance your preparation. So subtle changes have occurred in the flow of topics also. As I told you, that certain disorders, the classifications have changed. And so what chapter they were earlier added, that sequence of chapters has also been changed. And regarding this new version, we have India's only, as of today, say in the coming days, it might change, but as of today, it is India's only updated super specialty course based upon Nelson 22nd edition. It also contains updated videos. A lot of you have asked me, sir, AIMS Neonatal Protocol, third edition has now 3 volumes. All the 3 volumes are not relevant for NEET SS, but yes, they are relevant for INISS. So what we have done is we have taken out selected chapters, added sprinkling of Nelson, sprinkling of review articles, and created that content for you. Plus, on long-standing demand for people who are targeting INISS, a lot of students, including last year's toppers, also told me, sir, why do you neglect biostatistics? So we have listened to the complaint, and biostatistics has now been added in this chapter. And see, I'll be honest, I am not the right person to teach you biostatistics. You ask me to solve question, I can, but you ask me to teach me, that is not my job. So we have Dr. Neha Taneja. Ma'am is qualified PSM faculty. She is a superstar in the field of PSM, and she's a regular Prepladder faculty. We have asked ma'am to create some content for the super specialty exam. So she has created 8 videos for all of you. So 8 special biostatistics videos have also been added in the program. Apart from that, you have concise notes, which are there along with the videos for quick revision. Hard copy notes are being printed as I'm talking to you, and they should be available very soon. And what we are going to do here is we are going to give you a mix of old and new. What it means is, if you have already done a video and that video, Nelson has no change and Ghai has no change, IAP textbook has no change, or Cloherty has no change, we have not changed that. Because changing for the sake of change is stupidity, right? If something is working, don't fix. If something is working, don't try to fix it, right? That is the golden rule. So whatever has not changed, we have left them untouched. If there has been a change, we have updated the video. And if there is a complete change, we have completely updated the video. This old plus news approach we have done. You will see that in the new section, in the new version, there is a dedicated section called as Nelson 22nd edition updates. So all the new chapters, all the new things are going in that. So if you are running short on time and you just want to see what has changed, you can go to the older thing, you go to the new thing. The older thing remains at the same place. Plus, in the coming days, based upon the changes, Cloherty, the new Cloherty is also here. So based upon the new changes, we will be editing the older content, but we will be moving it into the separate folder. So this is again based upon the feedback which we got from a public poll that we did for the students. More flowcharts have been added. I'll give examples also. More clinical examples I've added. Some of them are stupid examples, but I told you nothing is stupid if it helps you in the exam. Past super specialty MCQs I have incorporated in the video. So you are going to have a lot of benefit, lot of exposure to the super specialty content. Upcoming fresh content focused on one-liners for repeat PYQ. I will talk about it in just 2 minutes from now. GTs and QBank are there for practice. Some of you have asked me that, sir, is the QBank also being updated? Let us be honest, QBank was updated last year. As of now, we have done the video editing, we have done the video update, the new Nelson based. At the same time, our team is actively working on the QBank. In the coming days, the QBank will have fresh questions created on the new Nelson 22nd edition. So first is the theory, then is the MCQ, and that is the approach we are taking at Prepladder as well. So they should appear very soon for you. And I'll just give an example. When I have discussed Cornelia de Lange syndrome, I have used an image like this from a standard review article. Because if you read that topic from Nelson 22nd edition, I know most of you have already bought or you have taken or soft copies there with you. See, the genetic basis has not been described like this in Nelson. I have taken the help of review article and tried to simplify what Nelson is saying. So basically what I'm doing is not telling you line by line in Nelson or cut copy paste. I am trying to explain the meaning of what Nelson says. So this is my effort to simplify Nelson for all of you. I have been a resident. I know how tough it is to balance your preparation and reading. Similarly, new Phoenix sepsis score has been added. So I have tried to explain in the form of a flowchart. This flowchart is not there in Nelson. So you know the score, but where do you fit it in real life practice? So that I have tried to incorporate, because again, you may get an exam question where they give you a scenario, but you will not know. You will know the Phoenix sepsis score. Everyone will teach you, right? But where to actually apply it, that I have tried to explain in the form of a flow chart, which I've added, right? Thirdly, staging of genetic, like for this example, Prepladder staging. The Prepladder staging, which is given in the books, it is very confusing. The original Prepladder staging, including the type 4 on which recent INI super specialty MCQ was asked, as I've told, I have added it there. And then another example on the Phoenix sepsis score, what to remember and what not to remember, I've tried to say. These are just examples I've taken from the content. As of now, there is about 20 plus hours of Nelson, exclusive Nelson based content available. Another 10 to 12 hours will be recorded by the end of the weekend. It takes another 3 to 4 days for that to be edited. And by 5th or 6th of October, you should have 30 hours of Nelson and changes in AIMS protocol content available, plus another 8 videos of biostatistics. And we are going to do something different, which nobody else, which we ourselves have not done. What we are going to do is we are going to take up simplification of complex concepts. Again, proper announcement for that will be made. That will not happen immediately, but it is going to be a dynamic course. So these are just some of the examples. Like for example, there is a disease called as trachopathy which has been added. Now trachopathy involves the T regulatory cell dysfunction. Nelson does not talk about T regulatory cells. You don't have time to read microbiology. So what I've done is I've given you a context for that, which you can add to Nelson and then read Nelson. It will make much more sense to you. And then what's on horizon? Horizon means coming few weeks. Dynamic course. Dynamic course means I will be interacting with you regularly. If you have any topic which you feel is deficient or you feel should be added, and if I and my team feel that it is relevant for super specialty exam, we will be adding constantly. Of course, because the notes will already be printed, the PDF version will be available to you. So it is going to be a dynamic course because I don't want that anything is asked in the exam which you feel was not covered in the app. See, perfection cannot be attained and there will always be a few questions which are not covered, but our aim is to have at least 90 to 95% coverage in just about 250 hours of content. Already 200 220 hours of content is there. We have added 25 hours of content more, and we are going to add another 10 to 12 hours of content more. These 20-30 hours in addition to the existing Nelson. The older videos where Nelson has not changed, we have not changed that. So, and any update which happens, we'll try to cover and add within the shortest possible time. For example, tomorrow, if you feel, you know, these GINA guidelines, they keep on changing every year. Whenever they will change, we will add it immediately to the content. We'll not go into the details. Older video will remain. Something changes, we will put a 10-minute video and add it. That is how we are going to make it. The dynamic, the only dynamic course. More about it, I'll be coming and explaining once I introduce more dynamic videos along with Nelson 22nd edition. PYQ approach, how to solve PYQ, what sort of PYQs are being asked, what sort of questions are being asked in NEET SS, how trend has changed. That section we are going to introduce. Third, INI SS specific topic updates we'll be introducing, and we have for now focused on the AIMS protocol for that. Controversies busted, which is the drug of choice in a few cases. You know that many places Nelson says something else, Indian textbook says something else, AIMS protocol says something else. For example, retinopathy of prematurity. So I have tried to burst those controversies in the videos themselves. In the end, we will be making some specialized videos where you will have comparison of different controversies and you can take a calculated call. That will be useful in your rounds as well. And then preparing for departmental assessment. Again, this is something that is not immediately available, but we'll try that by the time INISS is done and your results are out, people who get selected the theory exam want to prepare for departmental assessment, areas to focus, questions asked, and summary of that we are going to give. So INISS people who have already, who are the niche cream, but also because they are not a mass market, they have been neglected. We are now catering to them also. So whether it is your NEET SS or INISS, you are going to benefit from these new additions, right? So this is all about the content. And now I'll be taking up the whatever doubts you people have, I will be taking up those doubts with you. So if you have not done. So Vishwas is asking all videos and QBank updated as 4.0. As I said, videos updated. What has not changed, we have not touched. What has changed, we have changed. Approaching INISS, I will be coming live around this time in the next week with all of you because INISS is due in October. So first week of October, I'll be connecting with all of you. What I will advise is, first of all, be thorough with the videos in pediatric oncology in the app. Secondly, selected portions of Lenzowski are important. Thirdly, leukemias, lymphomas, neuroblastoma, Wilms tumor, and brain tumor. These five, read in detail every single word from Lenzowski. And any table in leukemia and lymphoma in Nelson 22nd also needs to be added. Anything apart from that is bonus. Don't go into the details of doses of the chemotherapeutic regimes. They are not asked. Also remember, also read the bone marrow transplant and the various types of hematopoietic stem cell transplants which are used in hematological malignancies. Now, Vishwas is asking, when is the best time to take the course? Vishwas, you can take the course anytime. Because obviously, if you take the course in third year, or you also have to submit the thesis, you also have to pass university exam and prepare for history taking an examination, and then 250 to 260 hours of content. Do you think you'll be able to finish? So the best time actually is once you enter, try to subscribe the course. And once you subscribe, as I said, it is a dynamic course. Something changes. Before your seniors ask you to make a summary of that, we will be there and sharing it with you in a video format, right? So for the subtle changes which will happen over the year, will not immediately create notes for that. So new notes are being created. We will wait, and once the year is over and we feel sufficient quantity has changed, we will create. But videos, we will give it to you as soon as possible as the updates happen. So the earliest time I would say is maybe first year or the beginning of second year. At the same time, this is not a replacement for your bedside teaching. I always say this: pediatrics is learned with the patients, not on computer screen, not on your mobile phone screen. But once you've seen the patient, you come back, you don't have time to read Nelson, listen to my video. For example, T regopathy, listen to my video and then read Nelson. You would understand much better. I'm not saying I know more than Nelson. Nelson is the boss. Humbly, I'm trying to simplify it for you by adding content, making it more simpler, more digestible. When will new notes be added? Uh, for those who recently purchased 3.0, you will get automatically upgraded to 4.0. So no, don't worry on that. When will new notes be added? New notes will be added very soon. We are working on adding those as well. Few advice for INSS neonatology, how to go for October exam. Vimal Kumar, AIMS Neonatal Protocol, third edition. Every single thing you should remember, general pediatrics from the videos we have added, plus ROP from what I have explained to you. Why? Because I have tried to add a few points which are controversial. So you will have no controversy when you sit in the exam. So AIMS Neonatal Protocol, Prepladder SS, Cloherty selected portions. First, particularly Cloherty, the first three chapters of Cloherty are very, very important. First three chapters of Cloherty. Just rectify them, cram them up, and sit in the exam. Then how to approach INISS pediatric neurology, Prudvi. For pediatric neurology, if you see a huge amount of content we have created, at the same time, as promised with many of you, EEG findings in various disorders, named signs in various pediatric neurology disorders, and hallmarks of various neurological disorders and neuroregression will be added shortly in a separate section called as INISS exclusive topic. And I will try that before mid-October, this is live and available to all of you. That will be available to all of you. If you don't find the video, you can bug me, you can call me, you can spam me. I will do it overnight. It will be available to you. That is in my to-do list that has been added to it. For now, we are into post-production. It 70% Nelson already done, already videos available, 30% in post-production right now. Yes, Anuj, I will take system-wise for INISS. I will be coming live 1 week from now. The dates will be announced soon. INISS system-wise areas to focus, not to miss in last 1 month. I will come and discuss with all of you, right? And I will add snippets from what toppers have also said in their interviews, right? So team is working on asking them and creating a PPT kind of thing. So that PPT I will share and I will summarize the thing with you. Few topics still logged in for like HU, and when will it be released? Vimal Kumar, they will be released soon. We are working on that. Thank you. Yes, Arvind, regular grand test is a feedback. I'm just a minute. I do agree that we have less grand test. Coming days, I will work on that and I will discuss with the team because new Nelson has come up and it was already coming. So we decided to wait for it to come, but new GTs will come very soon. Thank you, Vimal. How to approach pediatric gastro and which is best book along with Nelson. Nagesh, unfortunately, there is no single book for pediatric gastro, just like you have for others. Like for neonatology, you know Cloherty. For cardio, you know it is Park. But for gastro, there is a book by Riaz also. There is a Oxford handbook. There is a small Oxford handbook for pediatric gastroenterology. If you find it, that is also useful because last time also many questions were asked related to pediatric gastro from there. Try to read the IAP guidelines and Indian pediatric guidelines alongside. right? And the recent scoring systems in gastroenterology are important. And then there are the usual suspect, celiac disease. Sometimes as simple a thing as whether sorghum is safe or semolina is safe. Such kind of questions create confusion. So just increase your accuracy rate in those topics. Ah, thank you so much, Doc. Thank you, Anuj. Anil Reddy, thank you. I'm not the best. I tried. I'm trying to give something to you so that you become the best. I have retired from competitive exams. I'm like Rahul Dravid. But for me, my World Cup will be you people getting that rank and lining up for interview. Lining up for interview. Few months from now, I want to take your interview. So that is when I would say yes, I am the best. Mocks for ionized super specialty, yes, considered. Let me just start. Next, heads of taking huge content simplifying. I am trying. I'm still working. You don't like it. You're most welcome to tell me about it. Right? I will rectify myself. I don't consider myself, more knowledgeable, a bit older than you. Maybe I've seen the game, understood the game a bit, and I know that if I only cut, copy, paste, and give it to you, you are not going to benefit from it. You're better off reading it yourself. So I'm trying to simplify. You don't understand something, or you want me to, explain it again. It's okay. In the coming days, I can always create something additional on that. And there are more things I don't want to announce here. The things I have announced are something we are already doing. The team is already working, videos I'm already recording, notes already being made. So those things. There are other things which I won't announce, but after the INISS is over for NEET SS, I hope you know the date is here. So we will be doing a lot more things on that. So it is better that you subscribe and you start doing it, because doing 300 hours of content and MCQ practice, it's not going to happen even if you sit at home and prepare. Neonatology live mocks noted. Yes, Arvind, mechanical ventilation and graphs. It's a tough topic. If you look at the upcoming topics, I've already discussed CPAP in newborns. Upcoming topic list, you can check on the app. HFOV is coming, non-invasive ventilation is coming, SIMV is coming. So I will try to simplify those topics for all of you, right? So apart from that, obviously graphs and their interpretation, quick summary. No concepts, quick summary. If you get an exam, how to mark. That I will be adding. Reason, why quick summary, why not detailed? Because it is asked in INISS, and INISS is only a month away from us. So I want you to just go through them as soon as they release. And as I said, by 5th October, they will be available to you. How to remember genes? Cricket lover, you can't remember all the genes. Like I'll tell you today only, just a few hours back, I'm wearing the same shirt. You can see the same shirt when the video comes. I have recorded a video on the inherited surfactant deficiency disorders, also called as SDDs, right? SDDs. So SDDs, I have talked about, there are four types of mutations, four types of deficiencies which can cause a RDS-like illness. So SPB, SPC, then you have ABCA3, and then you have a TTF1, right? How to remember their genes? I have given you a stupid example. 2, 8, 2, 8, 16. 8, 2 multiplied by 8 is 16, and minus 2 is 14. Like that kind of stupid example I've given. But trust me, when you read it, right now you will be thinking what nonsense are you speaking. But when you read it, you listen to it, and you open your Nelson, you will find it much easier to recall, right? So that is the only way to remember those genes. End of the day, not every gene is to be remembered. Only for important topics and PYQs. In exam, there will always be one drug, one gene. You will have no idea. It's okay. Everyone, it will be the same for everyone. But the remaining ones, don't get the answer wrong in the exam. If it is acrodermatitis enteropathica, SLC 39A4, you should be able to answer in sleep also, right? So just that accuracy is what you should be working on. And book for targeting INI neuro. Don't read Swyman, right? Let us be honest. Don't read Swyman. Selected portions of the other one, Fenichel. Selected portions, I would say, of Fenichel are more productive. It is a doable book, but don't go into details. And Nelson itself will be the best one for that. And thank you so much for all of you connecting with me. This is all I had to share with you. Just wanted to give you a glimpse and tell you what is coming. Apart from that, First week of October, once I am done with all the videos and no more recordings are happening regarding the Nelson update, I will come again and we will be discussing INISS specialty wise areas not to miss. Will be coming in the first week of October. It will be announced to you, so you can join on YouTube. But for the content, you will have to subscribe. And for those who are already subscribers, you will be updated regarding GTs and mini test for revision. I have noted it down. I will be sharing with the team tomorrow morning. So thank you so much for your time. And I hope all of you are doing good. Festive seasons are also coming, but exams are also coming. Winter is also coming. I hope you get the reference. So do well and stay in touch. And this video, this content is not a replacement for Nelson. This is only to make Nelson simple. That is what the heading of my video was. Demystifying. I'm not teaching Nelson. I'm not qualified enough to teach you Nelson. All I can do is simplify Nelson for you. Let's not make it a Hawa, a mystery, right? Thank you so much. Not GOT, Game of Thrones. Game of Thrones had a bad ending. We will make our ending the best because it will be the last exam, super specialty exam that you will be sitting in. Lest your last exam be the best exam that you ever sat in. Okay, thank you so much. God bless everyone. Arvind, you can always contact me. You can drop me a message. Instagram, you can search Sandeep Sharma _108. Or you can find Sandeep Sharma Pediatrics. Find me somewhere. I'm always available. A bit of filter I might have used, but not so much that you can't identify. Drop me a message and I will reply to you. Right? Email ID. Okay, I'm typing it here. Let me just type. You can, on Insta, you can find me on Dr_Sandeep Sharma _108. And you can also mail me on sandydoc44125@gmail.com. Right? So you can mail me here, but more commonly, I will be obviously be visible on Instagram, right? So if you have any doubt, feel free to ask. All the very best. Do take care and do take care of the young kids that you are all managing, right? No compromise when it comes to clinical teaching. Your professors can teach you better. I'm just training you for the competitive exam. Thank you so much. Good night. Good night.